Good afternoon, everyone. My name is Dr. Ng Wai Chong. I'm the CEO of NWC Longevity Practice. It is my pleasure and with great honor that I'm invited here today to share with all of you something that I prepared many years ago when I was teaching a group of seniors in my previous workplace, what to ask when we're seeing our doctors. So I've been a primary care doctor for more than 20 years now, seeing patients coming to my clinic, and many of them, I have to visit them at home. And I find that this is one of the important things that I like to share with all my patients and their caregivers. So before I start, let us have a poll. Do you know what to ask when you're seeing your doctor? So please take the poll, and then I'll wait for your result. So as I was saying, I've seen many patients. Many of the time they come and see me in the clinic. They've got either an acute illness like a diarrhea, or sometimes something a bit more chronic like diabetes, dementia, stroke, and so on. And some of them are very quiet. They're just passively waiting for me to share with them what are they supposed to know. And there are also some patients who would write down onto a notebook what they want to know from me. And those I find that those patients were writing down to take notes, were prepared questions to ask me. I find that they are more proactive and more empowered to take care of their own health. And as a doctor, I appreciate that a lot because, we just got the result from the poll. The majority says no. So that's good. So today I will share with you what do we need to ask our doctors. At the end of my presentation, I'll give you a checklist. That's when you can take a photo or take a screenshot, and maybe the next time you see a doctor, you can use a checklist and ask your doctor. Okay. So I have this friend who I meet regularly. And he was sharing with me his frustration caring for his mother. His mother has high blood pressure, very stable, seeing polyclinic regularly. And so he was sharing with me, one day he asked his mother, "Oh, you went to see the doctor. What did the doctor say?" And the mother was saying that, "Oh, everything is okay." So, oh, good. So he was happy. And but the mother said, "But he asked me to do blood tests." Then my friend was frantic, a little bit surprised. "Oh, why? Why did the doctor want to do blood tests?" And the mother couldn't answer. She was like, why? So my friend was frustrated, flustered. And then why you didn't ask? And then she said, "Oh, the doctors don't like so many questions." And then my friend was, "Oh, of course, then let's work for them. So what's the test result?" And then again, his mother was silent, couldn't answer. So that's actually quite common. So if an older person were to see a doctor, sometimes they don't ask enough questions, and then the family members are so worried. Like later in the day, I have to call a family member of a patient that I just saw yesterday to explain to her the consultation with the parent, because sometimes seniors are not entirely empowered to manage their own consultation. So we need to speak to the caregivers as well. But today I would like to empower all of you. So first of all, what I hope to share with you what I hope to share. I would like to explore the reason why we need to ask questions to our doctors, and then I like to share with you what exactly do we ask. Okay. At the end of it, I'll make a summary. And I'll elaborate a little bit, but every one of us is different. All the conditions are different. The questions are just sample and examples. But the main headings are the main ones that I would like you to take home as a take-home message. Okay. Why do we ask questions to our doctors? Okay, so when we see our doctor, we pay for the consultation. It is a consultation. And healthcare, whether be it acute problems such as a simple cough and cold, flu, diarrhea, or is it something a bit more chronic like diabetes, high blood pressure, cholesterol problems, even stroke, dementia, heart attack, all these conditions, we are our main caregivers to ourselves. So if healthcare is a teamwork, we and the doctor, we are health partners. It is a partnership. The doctors do not live with us and they are not us. So we need to ask the questions so that the care is relevant to us. Okay, so healthcare is a partnership. And medical consultation, as the name implies, is a consultation. Means I have questions, you give me the advice and the answers. So you can test it. Today, if I don't give you poll questions, pop quizzes, and if you don't come in with some questions in your mind, sometimes the lecture like this, you may just forget it, it go through 1 year and out the other. But if you come in with some questions in mind, you participate actively in the pop quizzes, the polls, then you find that you benefit from talks such as this one, because a lot of time we got lots of information, but by merely reading, you may not absorb it. But if you have a question and they're answered, you can learn it much better. And we need to know so that we can take charge of our own health, because the person most affected by our health is ourselves. So we need to be empowered. And the most important first step in empowerment is knowledge. For knowledge is power. So we need to ask the questions. And the result is better than if you just leave it to the doctors, because the doctors they know from their understanding, their training, their education in science, in the evidence to support treatment of the various diseases. But all the evidence, the researchers, were based on population, although they're representative, but they're not us. Our life is special. Everybody is special. We have special values. We have special way we live our life, our diet, our habits. So we need to apply it to our life. And so we need to ask this question to the doctor so that he can apply the scientific knowledge onto what is relevant to our life. So the result is better than we just leave it to the doctor. So I hope you are convinced that this is why we need to ask questions and not be passive recipient of the consultation. So a pop quiz again. So you can answer this onto your Facebook live chat. So why should we see the doctor? This is related. If you listen carefully, you would answer this easily. Is it because it is important to be an informed partner of our health? Or is it because we need to keep our doctors busy? We paid good money for it. Yeah, so I look forward to your answer under the chat. Yeah. So I hope you can understand that when we see a doctor, we need to be very active. We need to be actively participating. And as a doctor, I tell you, a patient who is actively participating, I really will appreciate it even more, because I know what is important for this person, what is his greatest concern. And then whatever treatment that I prescribe, I understand that it will be more relevant and it will be more effective to care for the patient. So this is the reason why we need to ask questions to our doctors. So I look forward to you participating actively onto the live chat. Okay, is it 1 or 2? So do we have the answer? Okay, so I'll go on with a list of questions subsequently on what are the things we need to ask our doctors. Okay. Yeah. Okay, so while my colleagues are compiling the answers, I have quite a few slides to share. Perhaps I move on to my subsequent slides while we're compiling the answer. Okay, so the next section is, okay, great, I've got the answer. Majority on your live chat says 1. That is the correct answer. Okay, it's important because we want to be informed partner for our own health. Now, what are the questions we need to ask? The first question is, so be it an acute illness such as a diarrhea, vomiting, pain at the stomach, or a fever, we need to know what is the diagnosis. The doctor, how do they make a diagnosis? They'll take a history and then they'll do a physical examination. Sometimes they will do some blood tests, but sometimes in order to confirm the diagnosis, they need to do some blood tests and x-rays. But before the blood tests and x-rays, usually through history taking, asking you some questions, as well as physical examinations, they would have some idea, some provisional diagnosis. So you can still ask the doctor, what are you thinking of? Why do you want to take the blood test? Then the doctor will explain to you. For example, yes, you have diarrhea. Yeah, very likely it is food poisoning, but you know what? You have a history of constipation. There are people with constipation and they can present with diarrhea. That's why I feel an abdominal x-ray is useful, for example. Or that, well, yes, you have a fever and you have a cough, and very likely it is flu because it is flu season. But because you are you have of a certain age group, and then your fever is very high and you look a bit too ill to me, I will need to have an x-ray. So these are the reasons why the doctor do the test. So it could be an influenza, but it could also be a pneumonia. So you can ask the question related to diagnosis. It's useful for us because sometimes the diagnosis can help us identify the cause. And also with the diagnosis, when we go back, we can actually read about it. But usually in the first consultation, the doctors cannot fully confirm it, but they can still have a working diagnosis that can be very useful for you to know. So of course, if you have diagnosis, then the treatment will follow. The most important step in treatment is making the diagnosis correct. Okay, so once you have a diagnosis, there'll be treatment. But there are some conditions you don't need treatment. For example, if we have a cough or a cold or a flu, most of the time they'll recover by themselves. So we can ask this question whether if I don't treat, okay, most of the time the doctor will tell you this is a recommendation treatment for you. But there are some conditions that we may want to find out. For example, I have got of a certain age group, all of us are at risk of developing, say, dementia. Dementia. So we start to have memory issues. We may not be able to remember things, and the doctor suspect that we have dementia, but they cannot be sure until they do some brain scan. And then for you, you are quite concerned. You heard that dementia, there's no cure. And so you can ask the doctor, what will happen if I don't give any treatment? Then the doctor will share with you the progress of dementia. And then if you treat with, say, anti-dementia drugs, what kind of progress that you can expect? For example, if you take Aricept or Exelon, you can delay the progress of disease. If you don't take, you can find that the progress of the disease can be a bit faster. So it is good for us to understand this so that we can be more prepared and make good decision about whether do we want treatment or not. Okay, so so it depends on what kind of illnesses. Some illnesses, maybe not treatment is an option. Okay, some diseases, yes, treatment is always valuable. Okay, so we also want to know what are the complications. For example, diabetes. If I don't treat, say today, my blood sugar has been just discovered that it is a fasting blood glucose is say 9 millimoles, and I repeat it, it's still 9. So the diagnosis of diabetes can be made, 2 fasting blood glucose high. And if you don't treat, what will happen? Then the doctor will say that if you don't treat your diabetes, you can get all the complications of diabetes. If you treat your diabetes, it's well controlled, you may delay the complications, even such a point in time that throughout your life, you don't experience the problems associated with kidney failure and problems with your blood vessels. So you want to know whether you should treat or not, what will happen if you don't treat, and what are the complications, like diabetes, complications on the eyes, on your blood vessels and your nerves. So some people, if they neglect the diabetes, they may have to have amputation of the leg, so if you totally neglect it. But if you can compact, you can control it, you can really avoid all these complications, and it can extend your lifespan with good quality of life. Okay, so there's a huge difference if you treat and don't treat, because people with diabetes frequently they don't feel unwell. Okay, so these are important questions so that we can be convinced that we can treat. And if we want to treat, what are the plans? Because diabetes is another example, high blood pressure, the other examples, dementia too. Many of these chronic diseases, we need to know how to take care of ourselves. So what is the plan? The doctor may need the help of other health professionals. So sometimes, for example, diabetes, you need to have detailed understanding of how do you take care of your diet. So a lot of nurses are well trained in this. Okay, what do you look out for? How do you check your feet? How frequently do you check your eyes? Okay, so all these require some help of podiatrists, nurses, and a dietitian. Okay, so there may be other network of community service providers that can help us. Like community health centers. Now there are a lot of GPs for people with diabetes. They like to refer you to the community health centers where you can have your eye screening and food screening annually, and so you can make use of community services. Say dementia. So dementia, usually the family members will be accompanying the older person with it, and there are many community service providers can help to take care of somebody with dementia. So this should be part of the plan. So we should ask our doctors, okay, so I have dementia or I've got diabetes. What is your treatment plan apart from giving me the medications? Okay, so of course, typically when you see a doctor, they usually medication will be prescribed, but not always. So some care plan require medications, but there are also care plan that do not require medications, such as physiotherapy, prescribing you exercises. For example, if your condition is diabetes, the doctor would like you to exercise more, because if your weight is well managed, your BMI is relatively low, like 23, 22, or 24. Okay, so your diabetes can become better controlled. Okay, so with exercise, with rehabilitation, you can manage your diabetes much better. Same for dementia, same for heart disease, same for cholesterol problem. So there is a medical care plan involve medication and involve non-medication. And there are also other general health advice, not just related to diabetes itself. Whether you got diabetes, dementia, hypertension, you still need to manage the rest of your health. For example, now it's a flu season, and for all of us above the age of 65, we should receive our pneumococcal vaccines, okay? At least 2 doses 1 year apart. So flu season, flu vaccination. So these are all important healthcare plan that may or may not related to the diagnosis that you saw the doctor for. You got diabetes, high blood pressure, cholesterol problem, dementia, you should still have vaccination, you should still have a healthy diet, you should still exercise regularly. And in my slides, there are also a few other important administration points, like you should do lasting power attorney. The Mental Capacity Act that was enacted in 2008, in effect 2010. So we can elect somebody to be our decision maker if we lose our capacity to make decisions. So all these are important part of our overall health plan. So after the diagnosis, and we need to know why is it important to treat, and then finally, what are the treatment and care plan? And we would also like to know, how did the illness come about? It's not about crying over spilled milk. It's understanding the causes so that we know how to prevent it from getting worse. Okay, like for example, diabetes is related to being overweight. So if you can lose weight, diabetes will be better controlled. High blood pressure is related to drinking, related to overweight. Of course, related to family history, and that one we can't do anything about. But if it's related to drinking habit, high salt diet, we can prevent the blood pressure from getting worse. So it's important to know the cause so that we can prevent the illness from getting worse in the future. And we can also, if for example, the illness is an infectious one, for example, if you catch a cold or influenza, then the doctor say, oh, this is a viral infection. Oh, in that case, I should wash my hands and wear mask. Yes, now it's COVID-19 pandemic, but in the future, for perpetually, we are always affected by infectious disease. Most commonly is influenza. So if we catch it, we need to prevent it from spreading into our family. So understanding the diagnosis, how it happens, will help us protect our own family. So after you got the diagnosis and also the cause, you also like to know, how do you monitor your own health? What are the signs and symptoms I should watch out for? Okay, so it could be the signs of the disease. For example, you have an influenza, you have a cold, you see a doctor. The doctor says this is a cold, you should drink more water, I'm giving you some antihistamine and you rest more. Okay, then what are the signs and symptoms I should look out for? The doctor will say, because influenza and cold sometimes can lead to pneumonia. So doctor will tell you what are the signs and symptoms of pneumonia. Severe fever, so cough with a lot of productive cough with a lot of sputum, especially if they appear to be yellowish, greenish, and smelly, and then you may feel a bit breathless. So if this should happen, okay, what you will need to do something. So that would be the next question. So you need to ask for the signs and symptoms of the disease, of the complications, okay? For example, if you have diabetes, what are the signs and symptoms I should look for? The doctor will say, if you take your medicine, but you miss your meals, you can run into hypoglycemia, low blood sugar. The doctor will educate you on the signs and symptoms of hypoglycemia. Okay, and so you need to ask about the complication of disease and also side effects of treatment. Too much medication for diabetes, you can also get hyperglycemia. Too much medicine for your blood pressure, you can get hypotension. The blood pressure become too low, you can feel giddy. So the doctor will explain to you the side effects of the treatment. So if he forget to do that, please ask about it. So what are the signs and symptoms I should look out for related to the disease, the complications, or the side effects of the treatment? And what should I do when this or that should happen? So if you have a family doctor that you see regularly, please go and see the doctor when his clinic is open. So ask the doctor about it. So he'll be most welcoming of you to come back and see him. But if it's in the middle of the night, he might advise you to call 995 and go to the emergency department. So you write down the instructions. Okay. So when should I see you again? So if everything is fine, I don't have all the symptoms and signs of complications of disease progression or the side effects of medicine, then when should I come back and see you? The doctor usually will give you an appointment to come back and see them, whether it's the acute illness or chronic illness. Sometimes for acute illness, the doctor trusts that you will be fine. He may not give you a return appointment, but sometimes he might. So you ask them, okay, so so that he can be reminded, yes, maybe I should see you again in 1 week's time. If you have a flu, maybe 1 week's time, just to make sure you don't catch a pneumonia as a complication. Or that if you've got diabetes, the doctor gives you 1 month medicine or 2 months medicine, you're supposed to come back to for the review. And you should also find out if you've got any urgent need, what should I do? Okay, so how do I make an appointment to see you? So generally, if you're seeing a GP, there's usually no need for an appointment. But if you're seeing a specialist in the hospital, yes, it's not so easy to access them. So you have to find out, when is my next appointment? Is something urgent to happen? Do I go and see my doctor, or do I come to A&E, or do I call your clinic to make an urgent appointment to see you? And in the next appointment, what are you looking for, so that I can take my own notes and share with you? So sometimes the doctor newly diagnose you with diabetes or high blood pressure or any other conditions, they'll prescribe a list of medicine for you and will see you in a month or 2 months' time. He would like to find out whether you suffer from the side effects, okay? Whether you're able to deal with the diet therapy and exercise program. So you may want to do some diary about your diet and also whether you experience side effect from medicine. And then you can bring it to the doctor the next time. So find out what he wants to see you for. Then you can make some preparation. And also, we like to be proactive and empowered in our own care. So we would like to find out what are the materials I should read. So there are many resources online. Some of them are trustworthy, some of them are not. So let us hear from the doctor what are the ones that he would recommend. Okay. So I finished the checklist on what to ask the doctor. Let me ask you, give you another pop quiz. Okay, what are the set of questions useful for when we see our doctor? Okay, is it for acute illness, chronic illness, or both? Okay, please answer onto the chat. This is a trick question. Okay, so there is a lot of information for you just now. I have compiled everything into a simple checklist at the next slide. Okay, but I really want to explain to you why is it important for us to be empowered and be curious about our own conditions. And when we ask questions, what are the things that we need to ask? It is good to prepare ourselves before we see the doctor. Make a list of questions that we like to ask him or her. So it depends on the disease. I gave you a very general list, but some diseases need more questioning. Some diseases you can have less questions around for the doctor. Okay, so the majority say both. That is correct. Acute illness, chronic illness, we need to be empowered to take care of it, because especially for people who are of the older age group, acute illness can complicate into become a serious illness. So we need to be empowered. So both of them require questioning our doctors. So this is a checklist, just a recap. What is my diagnosis? What will happen with or without the treatment, so that we can be convinced about the treatment and make a choice whether we want treatment or not. What is the treatment plan? There are some medications involved, some medications are not involved, some involving other community services, and also we cannot just ask around that particular diagnosis, but overall general health, we also need to have a plan, such as advanced care plan, lasting power of attorney, vaccination. How did the illness come about? This is useful for prevention of it progressing, and also useful for us to protect our family. What are the signs and symptoms to watch out for? Signs and symptoms related to the disease progression, related to complications of the disease, related to side effects of treatment. What to do when these signs and symptoms happen? How do I come back and see you? Okay, when should I see you again? So all these are questions that we would like to ask our doctor. Okay, should I refer to any website or reading materials? Okay, as I mentioned, there are a lot of information out there. Some are reliable, some are fake. Okay, so ask the doctor, and then he'll guide you to some good sites, or you can Google and then share with him. Is this a good one? Okay, generally WebMD, generally those from MOH, from Singapore Ministry of Health site, they are all very reliable. Okay, otherwise the doctor may have his own material to share with you. So this is the checklist. You may want to take a photo or take a screenshot. Okay, so that is all for my presentation. Just to share with you, before the question answer time, I have a few message from the organizer for you. Just a note about myself. I'm a CEO of Longevity Practice Private Limited. I do mostly consultancy services for service providers in the community, for some government agencies, and also charitable organizations. But I also run courses online. Like now I'm running a mindfulness course for beginners on every Sunday. And I also occasionally see clients at home, but I have a clinic with South Foundation every Monday. So so that is for ambulatory clinic. But I do home visits for people who are homebound. So let's see any questions here. Okay, I have a question. Should we get our family members to be present for a medical consult? Okay, generally up to your comfort. Family members are very helpful because they give us some kind of emotional support, especially if the condition is something we're worried about. Okay, so at least we have a family support. And also, if the condition is chronic, we also like to have 2 ears. In case I miss out on some important points, I have a family member to help me listen to the doctor's instruction. And also sometimes when we are caring for ourselves, our family is also our team, our partner. We like to align. The doctor said this. The doctor's instruction was this. These are the things to watch out for. So all of us are on the same page. So for these reasons, emotional support help us to capture some important facts, and also aligning our common understanding by hearing from the horse's mouth together. Okay, that will be helpful. So should we get our family members involved? If you feel that these 3 reasons are important for you, for complex conditions, chronic conditions, serious conditions, we need some emotional support. Yes, we should get our family to come with us. Yeah, so that's the first question. I hope I can answer that question. Okay. The second question, if we're unable to attend the consultation with our parent, can our parent call us during the consultation so that we can hear what the doctor is sharing and also ask questions at the same time? Yes, I like that. So sometimes when I see an older person, but I feel that this consultation is really crucial for the family to hear, I will ask the older person for permission, and then we will call the family member and we'll use WhatsApp video or just on speaker mode, and then we can talk. And I do have some of my seniors clients, they go and see the specialist in the hospital together with their family members. So as a family physician, seeing them in the community, when I call the hospital specialist, sometimes they don't remember the older person. And so I like to do this. I ask them, when in front of the specialist, ask the family member to give me a call. Then we have a conference, we like having a meeting. Then I can help the older person and the family member to ask the specialist some pertinent questions so that I know how to take care of the older person when they come back. So it is best to use technology as much as we can. So so the question, should we call the family member and then communicate with the doctor? Yes. So the purpose is the 3, or to align our understanding, to capture all the facts that our parent may miss, and also to provide emotional support for our parent. Okay. Third question. People are scared to go to doctors thinking that they will be given wrong treatment. Is that scenario possible? I can't say it is not possible, but it is quite uncommon. The standard of healthcare in Singapore is very high, and the doctors are highly regulated by the Singapore Medical Council, and they are very, very well trained. All of us need to pass we need to accumulate sufficient continual medical education points. So all of us are up to date. So I don't think we get the wrong treatment. I think what may happen is that there can be miscommunication. Okay, so one way to prevent miscommunication is we have to prepare for the consultation, write down the questions we really have for our doctors. Okay, then when we see a doctor, the doctor may be busy with the computer screen. They'll ask us some history, do the examination, do the computer screen, and then just talk to us. Then before he finishes, the doctors, I prepared some questions for you. Do you mind if I ask you these questions? The doctor will definitely say, sure, please. Then you can ask, doctor, thanks for all this, but what do you think is my diagnosis? See what the doctor said. Okay, so they'll do that. So people are scared to see doctors, not because of being given the wrong treatment, but a lot of time they're scared to see the doctors because they are worried of the diagnosis and maybe the treatment. Do I need surgery? I'm very scared of surgery. That is real, because all of us are afraid if it is serious and we need surgery. But you have to ask yourself, is it better to know or not? The answer, of course, is better to know. But how do I prevent myself from feeling scared? Because being scared is very uncomfortable. So it is good to bring a family along, okay? And then we see a doctor that we trust. a doctor who is competent, skillful, but also caring, speaks well, and genuine. So generally speaking, the family doctor that we've been seeing regularly is the right person because they are well trained in communication. So sometimes seeing the specialist, we find a bit worried. We can talk to our family physician who can help us to understand and go through the condition with us. After the consultation with the specialist or our family physician, call the specialist or communicate with the specialist when we are with the specialist to help us with the communication. Communication is crucial. It can allay a lot of anxiety, and anxiety necessarily is will actually, we can't really think so clearly, so we need to have a good trusting relationship with our doctors. Okay, so preparing our questions, having a family member coming with us, having communication with our family physician are useful to help us overcome the fear. Question 4. Can we use our phone to record the questions and answers in case we forget or miss out important information? Well, the healthcare information is ours. We can, but it is polite to ask the doctor for permission. Generally, the doctor will say yes. Okay, so we can say, doctor, I'm a bit worried that I may miss out on some of the important points. Do you mind if I record it? And then if you ask for it, the doctor, sure, okay, you can record. So then you record, and then you can ask, and the doctor will explain. But bear in mind, when a doctor provides consultation, he's providing consultation based on the facts of the history taking, the physical examination, as well as the laboratory investigations on you. So whatever he's describing is actually for you. So he's giving the explanation for you and the recommendation for you. It is very specific. So this is how we can think that this information doctor have said is for you, and then when we go back, when we surf the internet, we read up more, it is for the general public. It may not apply to me, but it is good to have general information. But when we hear from a doctor, we know that it is an information related to my healthcare. Okay, so you can ask for permission, but don't record it without his permission, because the doctors will feel defensive, and then he might not be so intuitive in sharing to care for you, because there is no explanation why you're doing that. So it's good to be just be gentlemanly about it. Is it okay I record? Because I may forget. Then you can start recording. Okay. You can also take notes. Okay. Yeah. Question 5. During this period, only one person can accompany the patient. Can another person be admitted if the case is serious? So I suppose you're referring to seeing a doctor in the hospital. Okay, if the older person has disability and dementia or mental illness, you can request for it. I don't work in a hospital. I'm not sure what's the latest ruling now. I doubt it that a person with dementia can go and see a doctor alone. A family member surely will accompany. But otherwise, in order to reduce infection, catching COVID-19, which is a serious condition, it is only right care that we limit the number of people seeing the doctor. So in my clinic, we can have the older person plus one caregiver coming along. But if the rest of the family are all very concerned, what I do is I will call them on a chat, okay, either on video or just speaker mode. Then I'll just provide the consultation with the older person face-to-face and the caregiver and the rest of the family online. Okay, so this can be done. Question 6. If after a consultation, we are uncomfortable, doubtful, unhappy about the suggestion put forth by the doctor, is it okay to seek second opinion with another doctor for a second opinion if it's a critical illness? Definitely. So we have all the right to take charge of our own health. We can have second opinion, third opinion, as many as we like. But a lot of time it's not so much information overload. It's really, do you feel comfortable with the doctor? So, so if you feel uncomfortable that this doctor doesn't communicate well, or that seems to be hiding something, or that you feel that his explanation is not thorough, maybe he is missing out on things. Yes, you can request for him to help you summarize, and then tell him that you like a second opinion. Just talk to him nicely. I mean, as long as we talk to people nicely, people will be very nice with us. You know, this is understandable. Critical illness, if it happens to a doctor myself, I would also ask my friends, you know, my colleagues, maybe two, maybe three for their second opinion. But if I see one that I trust, I may not need a second or third opinion. So it is only right that we can have a second or third opinion. Yeah. So so this is all the questions I have today, and it's 2:45. I hope today's talk will benefit all of you in such a way that you can take charge of your own health and feel empowered to take charge of your health. And I hope you can have a long and healthy life. Oh, there's a last question. So very last one. Huh? Some doctors show annoyance when asked too many questions. Is that true? I am sure it is true, but how common, I do not know. And why are the doctors annoyed? Is it because we ask too many questions? I am also not sure. Sometimes he's annoyed because he has got stomach ache, he wants to go to the toilet. It could be that, okay? So if he shows annoyance when asked too many questions, just very politely say, sorry, doctor, I'm putting you on the spot, but I really need to have these questions answered in order to take care of my own health. Is it okay with you? You know, something like this, you know, be very gentlemanly, very polite, very mutually respectful. Then this is a good partnership. Okay. Yeah. So so that's all the questions I have time for, and I hope you're satisfied with the answer. Thank you very much for your time today. I'm very happy to be able to be here sharing with you this information. Thank you. And this is a message from the National Civil Academy. You find the talk useful, you can like and share the video with your family and friends to help them pick up these useful tips at their own pace and convenience. And if you want to learn more about me, you can go to the website nwclongevity.com. And you can call National Civil Academy at 6478-5029 to explore many other learning opportunities for seniors aged 50 and above. So do like and follow the Council for Third Age C3A Facebook page to be notified of new content in the future.